Jefferson Hospital, also in Philadelphia. So please, next slide. I have no conflicts to disclose. Okay, next slide. So viruses. So we all know that viruses have two activities that they need to accomplish. They hijack the DNA either to replicate or to commandeer to replicate, and then they also commandeer the mitochondria in order to gain the energy that they need. So when they do commandeer that mitochondria, we see that as an oxidative stress. Oxidative stress is something that affects the entire body, specifically the nerve cells, as it has one of the highest concentrations of the mitochondria. Oxidative stress, it will significantly affect nerve function, and the ANS is no exception to this. Through the ANS, oxidative stress affects all organ systems, all of it, in the entire body. Next slide, please. So the autonomic nervous system, just as a refresher, we have either what I explain to patients as a gas in the brake of the body, or the rest and digest, which is the parasympathetic, helps to restore our systems, and sympathetic, fight and flight, helps you go, right? In this case, the parasympathetic uses either cholinergic, vagus nerves, or respiratory, sinus, and with cholinergics, you respond quicker, they last longer, and the sympathetics, they use adrenergic or sympathetic change. In the US, we know a lot of med students are taught point and shoot type of mechanism also. So these here help control the blood pressure, heart rate changes, and respiratory sinus. So, and it all works like a seesaw, right? Where one's up, the other one's down. Well, in the case of dysautonomia, or autonomic dysfunction, sometimes the seesaw is broken, right? Where one's supposed to be up, the other one's down, is actually up, and the one's supposed to be down, but both down. So this is the idea we'll start to build up on. Next slide, please. So this is showing the effects of the parasympathetic and sympathetic nerves can affect, whereas sympathetic and for example, the pupils can cause dilation, and the parasympathetic cause constriction, and the sense of saliva, you have inhibition of saliva with sympathetic, and it stimulates it. The heart rate is also very important, where sympathetic increases the heart rate, parasympathetics will most likely decrease its contractility and its heart rate. The bronchioles is also important because, and sympathetic, you have dilation and constriction, and so in patients with like long COVID induced autonomic dysfunction, they will have shortness of breath, difficulty seeing, headaches from that. Their diet is changed. So we see all the effects that the autonomics affect. So as we can see, it's affecting the entire body and not just one part of the body. Next slide, please. So in order to test the parasympathetic and sympathetic, here we have a tool in which we use. It's what some call a PNS test system. So it's pretty much a combination of computer and algorithms that was made from MIT and Harvard, and that teases out the parasympathetic and the sympathetic. So when a patient comes to see us and they undergo the sympathetic testing, we put them under a 15-minute test, and where we check for 5 minutes there at rest, where we check their baseline heart rate, breathing, and blood pressure. And then we have them do deep breathing exercises in order to stimulate the sympathetic. Then we have them rest again, and then we have them do a Valsalva maneuver, a couple of Valsalva maneuvers, and test the vital signs in that procedure. And then after that, we have them rest, and then we have them stand up for 5 minutes. And again, we take the vitals. At the bottom screen, where it says A, B, D, And stand response, the gray indicates the normal. So everyone who's normal, that will be in the gray. Next slide, please. So this testing has actually been proven over and over again to be effective. In this case, we've done pseudomotor tests where we've had at least 340 patient cohorts showing 90% concordance with 89.4% negative predictive value and 90.4% positive predictive value. It's a very good test. We enjoy it. We rely heavily on this test as it's something that is able to identify the first signs of autonomic dysfunction. So the first sign of pseudomotor dysfunction, or autonomic dysfunction, begins with when you have borderline or low deep breathing or Valsalva response, and then you can note how it progressively gets worse. If you look here, in the examples, you'll see deep breathing, and where the blue dot is just below the green line, that's showing you that they're already starting to have some autonomic dysfunction that's progressing. Then if you move over, not look at the Valsalva, but the other one which says autonomic neuropathy, you can see that there's different levels of it. Whereas the gray, anything in the gray is normal, you can see as it goes further down, you go either autonomic or advanced autonomic dysfunction to diabetic autonomic neuropathy, and then all the way down to cardiac autonomic neuropathy. We have shown and proven that people who develop diabetic autonomic neuropathy or cardiovascular autonomic neuropathy can lead to disorders such as sudden cardiac death. All right, next slide, please. So COVID effects on the PNS. How does COVID affect it? Well, it can affect the parasympathetics, and that the parasympathetics itself helps to control and coordinate the immune system. So severe infections that would cause parasympathetic excess because they would work harder. And you can see this in patients who develop like vagal symptoms, like for example, they develop pre-vasovagal syncope. We see this very common even before the COVID. A lot of the patients that we saw would have had some sort of viral episode, like some sort of gastroenteritis, some sort of pneumonia, maybe some sort of headache, and maybe months later they would develop a lot of vagal symptoms, a lot of symptoms that when they would see their doctors, they couldn't understand what was going on, and they would come with us. We would do the ANSAR test, the PNS testing, and would show that they would have parasympathetic excess. The same thing with going with sympathetics here. Oxidative stress would affect the sympathetic nervous system. It would lead to things like sympathetic withdrawal. And why is that? Well, that's because, when we were seeing the anatomy, we saw that sympathetics are highly dependent on nerve cells, and nerve cells are highly dependent on mitochondria, and mitochondria is highly sensitive to oxidative stress. And you can prove sympathetic withdrawal with the stand challenge that we were showing you earlier. Sympathetic withdrawal causes orthostatic dysfunction, which you can also check for with blood pressure changes. When you have both parasympathetic excess and sympathetic withdrawal, then you have poor coronary and cerebral perfusion, poor perfusion of all structures above the heart. And what would that cause? Again, your pre-vagal symptoms, or even vagal symptoms. And so all of these with oxidative stress will either directly or indirectly explain all of the symptoms of post-COVID syndrome. Next slide, please. So here is a little diagram of everything we're talking about. So when patients develop oxidative stress, they usually complain of symptoms of either postural orthostatic tachycardia syndrome, neurogenic orthostatic hypotension, or some sort of dysautonomia. They would explain symptoms of fatigue, brain fog, memory difficulties, cognitive difficulties, headaches, coat hanger pain syndrome. Like they have all these pains in the top of the shoulder. They can have visual defects. A lot of them develop anxiety because of all that is going on, and the fact that they can't understand why. Nausea, vomiting is very common, diarrhea, constipation, chronic pain, dry eye, dry mouth, and the list goes on. And as you can see here in this diagram, the answer right there is simple. You have whatever virus that can affect your immune system. In this case, we're talking about COVID, and it stimulates the immune system, leading to inflammation, inflaming the neural, causing things like neuroinflammation, right? And that itself will go into the mitochondria, causing oxidative stress. And then you have mitochondrial dysfunction, low ATP, an altered immune response, low mitochondrial DNA, and that will give you your dysautonomia-like symptoms. And all of that is explained there. Okay, next slide. Next slide, please. So there has been many studies out there to talk about this long QT syndrome. Specifically this one by Dr. Harlan, who's an epidemiologist, cardiologist up in Yale. He's given it a broad definition, many interpretations of what long COVID syndrome could be, but it's difficult to target and mere definitive diagnosis. Not so many people know about testing PNS systems. And so when he was doing his research, he was specifically looking at the symptoms in different organ systems and following up on serial evaluations. But it's not enough. Just to follow up on the symptoms alone isn't sufficient. And in addition, detecting disease in a subclinical state when there are no symptoms with objective testing is going to be the most advantageous. Next slide, please. This is also more studies that have concluded that long QT syndrome is in fact an autonomic disorder. The list, you can go on and on, and I won't name every single one, but all these wonderful researchers did a fantastic job at doing that and showing that. And again, stating that the problem is that none of these studies directly measured PNS, and therefore their conclusions were nebulous and didn't give directions towards targeted therapy. Next slide, please. This here is showing you some of the findings from previous references. In this case, you have abnormal heart rate variability that's commonly seen in autonomic dysfunction, whether in areas like postural orthostatic tachycardia syndrome, or what we call POTS, orthostatic hypotension, or OH, or chronic fatigue syndrome. There has been numerous studies that have shown that they would be associated with lightheadedness and a normal pseudomotor or a normal cardiovagal function. Other ones showing low PSN, and others showing increased systemic nervous systems. And there's been studies that also have been showing how COVID has had an effect on the acetylcholine receptors, leading to the inhibition of the parasympathetic nervous system, and has exaggerated the sympathetic nervous system with subsequent progression of cytokine storm due to the inhibition of the vagal anti-inflammatory process. We can see here in this diagram exactly what's going on, where SARS or COVID has affected the PSN and affected the SNS activation. It has increased catecholamine effect, giving you sympathetic storm. It has decreased the neurovagal anti-inflammatory effects, giving you a cytokine storm, affecting the RAS activation and affecting cardio and vascular and pulmonary processes. This can easily lead to hypotension, dizziness, syncope, and many other symptoms that are seen in post-COVID that are not, some that can't be explained simply by the virus alone. And it's also similar to other disorders such as chronic fatigue syndrome and fibromyalgia. All right, next slide, please. So again, to emphasize that long COVID is an autonomic dysfunction. Studies showing that it might be corrected, but only at rest. Most of these symptoms are a result of abnormal responses to challenge. They've tried to see it with table testing measures, where you measure the total autonomic function, requiring assumption and approximation to theorize PSNS and sympathetic NS. But they all kind of come up with the same conclusion that it's just that you have your oxidative stress that affects the SNS and the PSNS. In this case, you can check the sympathetic nervous system with the stand challenge and the PSNS with the tilt table challenge. Next slide, please. So this is our study that we did. We're using the PSN monitoring system. So we have two suburban practices, one in New Jersey and the other one in Atlanta. And we had 152 long COVID patients. Now, before COVID started, we have seen many patients for autonomic dysfunctions. We had tested the PNS test prior to being infected with COVID, due to whatever causes that they came in for. They received pre-COVID-19 follow-ups. And then we also again consistently tested their autonomic function, both before and after receiving therapy. And